So the first type is, in our classification, the most recent classification is vascular tumor. The second type is vascular malformation. So when we are talking inside this chapter, we are talking about these two entities. But these two entities are subdivided inside. But there are main two entities, vascular tumors and vascular malformation. The vascular tumors are lesions with a proliferative character. The vascular tumor are lesions that have a proliferative component. Means there is reactive vascular lesion. The cells are reactive and they are typically all grouped in the benign category. Outside the main category of these vascular tumors, which is the infantile hemangioma, there are many other vascular tumors that are very exceedingly rare and have been difficult to classify. They could not classify them, but they put it under the vascular tumors which are benign in nature, proliferative in their character, with reactive cellular hyperplasia. But mainly, they are the infantile hemangioma. So what we need to know now is, when we say there are two main categories, vascular tumor and vascular malformation, the vascular tumor is mainly infantile hemangioma. Other many types are exceedingly rare and cannot be scientifically categorized. Okay? So when we talk about the categorization of this, we'll see now. When we talk about the ISSVA, the International Study of the Vascular Anomalies, we talk about, it's not the most recent, but I'll put it for you as a historical one in 1996, and it was approaching the most recent now. It was a modification on the molecule. When we say that there are two main categories, vascular tumor and vascular malformation, we should know that the vascular tumors are either benign, locally aggressive, or malignant, and the vascular malformation, according to that vessel included, simple or combined vessels. So when we say the locally aggressive in the vascular tumor are mainly infantile hemangioma and then congenital hemangioma. I'm sorry. The benign, not the locally aggressive. The benign is infantile hemangioma and also the congenital hemangioma, but mainly the infantile, which is more common. By far, it's more common than the congenital. And something called tufted angioma and spindle cell hemangioma, and other more rare types like the epithelioid hemangioma and pyogenic granuloma. Then the locally aggressive, when we highlight the benign, we highlight the infantile and congenital hemangioma, then other types. While when we talk about the locally aggressive, we highlight the capuciform hemangioendothelioma. Then others like the retiform and other rarer types. When we are talking about the aggressive, not the locally aggressive, it's the angiosarcoma, which is very rare, and the epithelioid hemangioendothelioma, not the retiform hemangioendothelioma, but the epithelioid hemangioendothelioma. So there is epithelioid hemangioma, which is benign, and retiform hemangioendothelioma, which is locally aggressive, and the epithelioid hemangioendothelioma, which is malignant. Then in the same classification, we see that the other category is the vascular malformation, not tumor. And it has a simple and combined. The simple is capillary malformation, and it's different from the infantile hemangioma, and the lymphatic malformation, and the venous malformation, the arteriovenous malformation, AVM, the arteriovenous fistula, AVF. And then we go to the combined, which is, take care, CVM, CLM. What's the meant of CVM? Capillary venous malformation. CLM, capillary lymphatic malformation. LVM, which is lymphovenous malformation. CLVM, capillary lymphovenous malformation. CAVM, capillary arteriovenous malformation. And CLAVM, capillary lymphatic and arterial venous malformation. These are the combined, and they are of all types of vessels. Okay? When we talk about the classification, and we go inside it to the vascular tumors. And we say that the vascular tumors mainly is infantile hemangioma. And it is something called reactive cellular hyperplasia, and the infantile hemangioma is the main category of it. And it's a benign category of the vascular tumor. And it's the most common of the benign category. After it, the congenital hemangioma and the tufted angioma, the spindle cell hemangioma and the epithelioid hemangioma and pyogenic granuloma. So when we talk about the infantile hemangioma, we say they are the most common. All of us see it in the clinics. And can be 2 or 3 cases according to your cases in per week. And the most common tumor of infancy, not of newborn, of infancy. They occur in about 4 to 5% in infants. But the early study of this infantile hemangioma, they were as high as 10%. After that, when we get outside of them, the wrong diagnosis, the wrong nomenclature, they are 4 to 5% of the infancy tumor. And after that, we say that the incidence is higher in premature, more than the term or the mature infants, Caucasians more than other races, and by far in females more than the males. According to reference, it's from 3 to 5 to 1 males. So it's 3 to 1 up to 5 to 1 female to male ratio. Risk factors include, for the infantile hemangioma, advanced maternal age. Number 2, multiple gestation. Number 3, placental anomalies, because there is a theory of migration of the placental vessels or cells to the body of the baby. And they have a very characteristic life cycle consisting of 3 phases. Proliferative phase, involuting phase, we can call it stationary phase, and then involuted phase. So it's first a proliferative phase, then involuting, then completely involuted.